Welcome to Fresh Start. Are you ready for health? We're here to talk about how to be physically fit. You can find this module on our website, freshstart.mhsystem.org, by going to the Learn the Basics and scrolling down to be physically fit. We are made to move. Physical fitness is the ability to carry out daily tasks with vigor and alertness, without undue fatigue, with ample energy to enjoy leisure time pursuits, and to be able to respond to emergencies. Just like the dietary continuum, we have the activity continuum. We spend way too much time sitting, watching screens, not moving, which contributes to our worst health. We need to be moving more, standing, walking, stretching, doing planned exercise to achieve the best health. Actually, that lack of physical activity contributes 6% to our heart disease, 7% to type 2 diabetes, 10% to breast cancer, and 10% to colon cancer. Physical inactivity also contributes to depression, overweight and obesity, high blood pressure, many other conditions including death. People who are physically inactive end up spending over $1,500 more in medical expenses per year. On the other hand, physical activity benefits us many ways. It decreases our risk of death, decreases our risk of heart disease and stroke and diabetes, colon and breast cancer, and risk of injury. It improves our mood and mental function and helps with weight loss and maintenance. For every hour of moderate activity, you actually save yourself about $19 worth of medical expenses. When comparing exercise to balloon angioplasty, that's the stretching open of those clogged heart arteries, in patients who have stable disease, that means they're not having a heart attack or advancing symptoms, the physical activity actually did better at keeping them well, avoiding heart attacks, and was a lot less expensive, as well as saving down the road hospital costs. So which exercise is best? It depends. The best exercise is one that you enjoy, one that's convenient for you, and one that you will do. Do you need to exercise? Maybe not if you regularly garden, dance, or do other vigorous physical activity. For most of us, walking is the easiest. It's inexpensive, no equipment is required other than some good comfortable shoes. It can be done anywhere and no training is required. What's the dosage? Well, at least you should be doing 30 minutes a day of moderate exercise 5 days a week, or 15 minutes a day of vigorous activity 5 days a week. Well, how do you tell the difference between moderate and vigorous? We use the talk test. For moderate exercise, you can talk, but you're too short of breath to sing. For vigorous activity, you're too short of breath even to carry on a conversation. If you do moderate activity, do it with a buddy. It's great to have a conversation partner. It makes it go quicker and it's more enjoyable. We would encourage you to aim to exercise every day. A brisk walk is great. If you're a walker, a pedometer is helpful to encourage you by counting your steps. You want to get at least 6,000 steps for some benefit. At least 10,000 steps is recommended for good health, but even more is better. When's the best time to exercise? Well, it depends. First thing in the morning before eating breakfast can aid in weight loss by burning more fat. After meals decreases that spike in blood sugar, which helps with better diabetes control and better weight control. Exercise is not a good primary strategy for weight loss. You need to control the calories. For example, eating a Snickers bar, you'd need to walk almost an hour and a half to burn off those extra calories. A Krispy Kreme donut, about an hour. Coca-Cola, about 45 minutes. If you remember that the average American consumes about 500 calories too much, that's about 2.5 hours of exercise a day just to burn off those extra calories before you even get to any weight loss. The math just doesn't work. You can't count on exercise alone to help you lose weight. You need to restrict those calories, and the easiest way to do that is eating foods that are high in fiber and water that fill you up and keep you satisfied. To keep that weight off, you will need to be aiming to do 30 minutes a day of vigorous exercise or 60 minutes a day of moderate exercise. If you don't, that weight's going to start to sneak back on. Are you ready for health? we're going to go through the different types of physical activity that you can do. Flexibility and stretching is really helpful for people who have limitations in their activities of daily living. It puts your body through the range of motion. So people who have trouble reaching up in a cabinet or reaching down to tie their shoes, doing this stretching every day can help them maintain that ability to do those things. You can do it for 10 minutes, 2 to 3 times a week, or daily if you need to get that range of motion going. You do a little bit of a warm-up, and you do this for all the major muscle groups, especially for those that you have some limitation in. You can do 2 to 4 repetitions, and you want to hold these for about 10 to 30 seconds, for a total of about 60 seconds. No bouncing. Don't bounce, you can tear muscle. No pain. If it hurts, you're stretching too hard. Nice organized ways to do flexibility and stretching are activities such as Pilates and yoga. Next, we want to talk a little bit about balance exercises. This helps to improve your ability to withstand destabilizing forces and therefore avoid falling. Here's a quick way to tell if you need to do balance exercises. Can you stand on one foot for at least 20 seconds without falling or reaching to steady yourself? If not, then you probably need to start incorporating some balance exercises into your life. You can do these for 20 to 30 minutes a day, 3 or more times a week. It can be part of your normal activity, such as gardening, housework, or standing on one foot while you're brushing your teeth. You can also get balance exercises through Tai Chi and yoga. When you begin, be sure to hold on to a support if you're unsteady to prevent yourself from falling and injuring yourself. Balance exercises actually decrease your risk of injury from falls, need of medical care, and decreases your risk of fractures. The next exercise is strengthening or resistance exercise. This helps you to have strong bones and muscles. The resistance can be created by weights, or these resistance or elastic bands, or even gravity. You should do these 2 to 3 times a week, 8 to 12 repetitions per muscle group. You want to separate the exercise from the same muscle group by about 48 hours, or otherwise you might find yourself getting a little bit too sore. Strength training decreases the risk of injury and pain and fatigue. Strength training helps improve the quality of life and your mood, sleep. It lowers your cholesterol and blood sugar. It helps you have a healthier heart, muscle, and bones. It's also helpful with weight reduction and keeping that weight off. Next, we want to talk about aerobic or endurance exercise, also known as cardio or cardiovascular exercise. It's movement of large muscles in rhythmic manner for a sustained period of time. This is what we usually think of when we talk about exercise. The CDC recommends 150 minutes a week of moderate exercise or 75 minutes a week of vigorous exercise. Double the amount for the increased benefit and maintenance of that weight loss. The session should be at least 10 minutes, but there's newer research saying it can be even shorter amounts of time to give you those benefits. You also want to work at breaking up those prolonged periods of sitting. Sitting for prolonged periods of time contribute about 7% to all deaths. Moving every 20 minutes that you're awake helps reduce that risk. What if you can't walk? Well, you can do things like chair exercises, use elastic or resistant bands, chair yoga, Pilates, swimming. There's options. The greatest health benefit from exercise comes from just getting up off the couch. Everything after that is incremental. How about getting a dog? They're a good motivator to walk. Find that buddy to walk with. That'll increase the enjoyment. Maybe you need an exercise trainer or a health coach. A body in motion remains in motion. A body at rest remains at rest. So let's get started. Are you ready for health? It's now time to set some goals. On the left sidebar, you can download the goal sheet. First page has a summary of the things we've been talking about. Remember, we're aiming to write some SMART goals. Maybe you'll want to get a pedometer and measure your steps daily this week. Maybe you'll want to start by walking 10 minutes a day, 5 days a week. Maybe you'll want to exercise 10 minutes after your evening meal for 5 days a week. So on the second page of the goal sheet, there's several options for you to choose from. You don't have to do all of these, but I would encourage you to do some. What's your choice of exercise? Where will you exercise? When will you exercise? Then, what type of exercise will you do? Will you walk? Will you use stretch bands, resistance training, or just get up off the couch? On our website, we have lots of examples of types of exercise that you can do safely at home. Are you ready for health?